It was exciting to see the role of T2 in those cases where culture didn't give us enough information. What is the potential clinical impact of the T2 bacteria panel? First, I would say that a positive T2 result may add timely information. We have a lot of patients in the intensive care unit who look like they are infected. They have sepsis, septic shock, but all of our cultures are negative. In this instance, T2 provides additional information in a timely manner that could alert us to the fact that this patient does have an infection with one of these six organisms. We should continue pursuing identification of the site of infection and source control. Another takeaway point that I thought would be helpful is that a positive T2 may be a marker of more serious disease. As we saw in our cases, some patients had a localized pneumonia that did not disseminate to the bloodstream. T2 was negative. There were some patients who did have a pneumonia, and T2 was positive. And is that telling us that we need to change our antibiotics, that we need to be more aggressive with our source control? I would say that T2, in our results thus far, are suggesting to pursue a more aggressive management when the result is positive. A persistently positive T2 may be an indicator of poor source control. So we saw in the first case, the patient had a Pseudomonas bacteremia, and then they were treated with antibiotics. Blood cultures were negative, but T2 was still positive. So what that can tell us is that the infection actually is not completely eradicated. We still need to pursue additional antibiotics, maybe better source control, despite the negative culture. And then lastly, and this kind of reiterates the points, T2Bacteria RUO positive results may prompt consideration of more targeted antibiotic therapy. The fact that we have a positive test may tell us that we are not successfully treating the infection with the current antibiotics.